Hi, Dr. Bobby Stanley with Stanley Dentistry. I wanted to come to you today and give you some information on Invisalign. Invisalign are clear aligners, clear braces that can help straighten your teeth without being intrusive in your personal life. So I'm going to turn it over to our lead Invisalign assistant, Zara, to tell you more.
Invisalign is a aligner system that is part of orthodontics that allows patients to be able to align their teeth for many different reasons. But what it does is it's it's painless, almost virtually painless. It also is pretty much invisible. You're not able to see them as much. And also it can be done in usually a faster amount of time. A lot of patients average maybe 6 months to a year of treatment. So with regular orthodontics, it requires the placement of brackets and the use of metal wires to be able to move teeth precisely, which is a very effective way. But what's great about this is that it's not fixed in your mouth, thus you're able to take it out and be able to have very proper hygiene whenever you're going about your day. It's something that is minimally invasive and it does well for a lot of our patients. So people who are candidates for Invisalign are generally people who have, they can have a wide range of malocclusion. So whether it is minor relapses, maybe they've had orthodontics done in the past, or it could also be for some more major procedures, such as if they've had teeth extracted and are interested in implants. It could also be well for if patients want veneers and they need to correct their deep bite. And so there's really very few limits to the kind of patient that would need or want Invisalign. The process of Invisalign works where there are a set of aligners that are customized for your teeth specifically, and then you wear them for 20 to 22 hours out of the day, which is the highest recommended effective time for them. And then you're only taking them out to eat and brush, and otherwise you're wearing them, and then they do the rest while you have them in. So it's aligning your teeth to get to the most ideal smile. So first, whenever you're in the office, we'll take an iTero scan. It's a 3D image where we're taking in its stitches the images simultaneously to create a model. That way there's no need for gooey impressions, and it's very, very fast. And what we do is we take a series of photos with our camera, and then we send it off to Invisalign to evaluate. They will help us kind of evaluate to get the best result for your smile. And then they correspond with Dr. Bobby directly. They're able to say that any adjustments that they want to make, if there's any specific things that either you're interested in as a patient, or if Dr. Bobby feels like it's best for your smile. She goes back and forth with the lab, and then they create your Invisalign aligners. So we receive the aligners back from Invisalign, and we bring you back in the office and make sure that they fit perfect for you. One thing that we might do at this first appointment is place attachments. What they are the little buttons of composite that go on the front side of your teeth. They serve as specific anchor or rotation points for the aligners to make them more effective. Sometimes this can also cut down on the amount of aligners that you'll need. And then after those are placed, at the very end of treatment, they're polished off. After that first appointment, where you receive your first few sets of aligners, you go home, you continue to wear them, you go about your life, and then your follow-up appointments will take place virtually. We provide a virtual platform, and that way you'll be able to check in with us. We'll be able to talk about how you feel like things are going, and we'll also be able to have you send pictures. We can check on your progress. We'll be able to see how your teeth are tracking. And if everything looks great, we'll set up a curbside pickup for you for your next few sets of aligners. This is great because this also doesn't require you to have an appointment. You just swing by, we make sure you get your next few sets, and then we have continued to follow up virtually. At the end of all of your aligner sets, it gives us a chance to talk about whether there's more that you want to change, if there's any minor adjustments that we want to make, and then if not, you're all ready to get your retainers. So you come in the office and we take one more scan of your mouth to get a perfect fit for your retainers. We send that off, and the turnaround time is about a week. You come back in, we polish off all your attachments, and then we get you set up with your retainers. In order to know if you're a good candidate for Invisalign, we have to gather some information about your oral health, your current alignment, and your smile goals. So come in for a free consultation and we'll be able to chat about your options.